friends, in this video we are going to see about the mbbs paralysis, which is caused due to damage to the brachial plexus. We have to study or we have to know the mbbs paralysis in 5 points. The first point that we have to see is the site of injury. The injury occurring at the mbbs point is called as mbbs paralysis. What is the mbbs point? The junction of the 6 nerves. Here diagrammatically we can show that here it is the subscapular nerve, anterior and the posterior division, whereas this is the nerve to the subclavius and this is the C5 and the C6 roots. Here the meeting point of all of these 6 nerves, which is called as the mbbs point, and the injury occurring at this point or surrounding to this point may result in the mbbs paralysis. Now, what are the causes of the injury? Then we can see that it is due to the undue separation of the head from the shoulder, which may be due to the birth injury or difficult childbirth, fall on the shoulder or during anesthesia. It may result in the mbbs paralysis. Now, next point, that the nerve roots involved mainly C5 and partly we can say that C6 it will be. Muscle paralyzed by the mbbs paralysis. Mainly the muscles, 4 muscles are paralyzed. They are biceps brachii, deltoid, brachialis and brachioradialis, where partly we can tell that supraspinatus, infraspinatus and supinator. The main muscles that are paralyzed due to the mbbs paralysis, it may be 4 and partly there are 3 different muscles. Now, deformity and the position of the limb we can tell if the arm hangs by the side, it is adducted and medially rotated, whereas forearms it is extended and pronated. Now, following movements are lost. These are abduction and the lateral rotation of the arm at the shoulder joint, flexion and supination of the forearm, whereas it is already pronated and extended. Therefore, we can't have the flexion and supination of the forearm. Biceps and supinator jerks are lost because mainly the biceps and supinator muscles are been paralyzed. Sensation are lost over a small area over the lower part of the deltoid. Lower part of the deltoid muscles, there will be the loss of sensation. In this way, we have learned about the mbbs paralysis. What are those points that we have to remember in the mbbs paralysis? First of all, the site of injury. This is the main point. Injury occurring at the mbbs point is called mbbs paralysis, where the mbbs point may include the junction of the 6 nerves. These are all the 6 nerves that we have to remember. Causes that we can know, that may be the birth injury, fall on the shoulder during anesthesia. Mainly the roots involved may be C5 and partly is the C6. The muscle paralysis, that may be mainly and partly. Now, deformities that how it represents or how the patient represents or adducted and medially rotated, whereas forearms it may be extended and pronated. Whereas next, the movements that are lost that we have to remember is that abduction and the lateral rotation of the arm of the shoulder have been lost, flexion and the supination of the forearm, biceps and supinator jerk are lost, and sensation toward lower part of the deltoid has been lost. In this way, we have studied about the mbbs paralysis in detail.